Good evening. Welcome to the Florida Post, organized by the USA Today Network of Florida. I'm Isadora Rangel, engagement and opinion editor at Florida Today. And my guest today is Rebekah Jones. Rebekah, welcome and thanks for being with us.
Thank you for having me.
You've probably heard Rebekah's name quite a bit in the news over the past couple of days. Rebekah is a former geographer with the Florida Department of Health. She was fired earlier this year for what she described as her refusal to manipulate data regarding the COVID-19 pandemic. She has accused Governor Ron DeSantis, who says she was fired for being insubordinate, of misleading the public on the true impacts of the COVID-19 pandemic. And on Monday, law enforcement officers raided her home in Tallahassee to serve a search warrant related to an investigation into unauthorized use of the DOH's emergency message system. The FDLE, Rebekah, has said that an IP address associated with your Comcast account was the source of this unauthorized use. You previously denied any involvement, but I want to give you the space to clarify that. Are you saying that the state made a mistake, that that's not your IP address, or that they're purposely perhaps trying to frame you here?
Well, the IP address that supposedly this message was sent from was provided by DOH. Law enforcement then supplied Comcast with a request to find out who that IP address belonged to. So the former employer who fired me for refusing to manipulate data, who I have since filed a whistleblower complaint against, is the sole evidence that there's any connection to me and this message that was sent through a system where the username and password is available publicly online on their own website.
Okay. And just a couple of hours before we went live, the FDLE released Bodycam footage of that search warrant. The video shows agents knocking on your door several times. They also called you a few times and you didn't answer, and they waited roughly 20 minutes for you to come to the door. And the FDLE commissioner released a statement that said, in part, that the video demonstrates that FDLE agents exercise extreme patience. Search warrants are one of the most dangerous events a law enforcement officer will engage in, and many officers are killed each year during the execution of search warrants. As this video would demonstrate, any risk of danger to Ms. Jones and her family was the result of her actions. I believe you previously used the word estoppel to describe how that search warrant was performed. I mean, what do you say now that this video is out? What is your response to what he said?
The video timestamp that I came to the door is at 13:48, so 13 minutes and 48 seconds. I woke up and put on clothes, got my husband to bring our daughter upstairs, which they say they saw in the video from inside the house, and got dressed and told them to wait upstairs because I thought I was being arrested and didn't want them to see that. At 13:48, the timestamp in the video, because there's two separate videos for some reason, and you can see that there's an officer clearly pointing a gun at my face through the window next to my door. And then, of course, none of the footage that they released has anything that happens inside my house, and only shows that I was visibly distraught by them pointing guns at my kids. My husband comes down with my 2-year-old in his arms, as I said he did. And I was upset by that and cooperated and kept my hands up the entire time. This video does not help FDLE. I don't know why in the world they thought it would. However, they did repeatedly state my phone number and my home address and didn't feel it necessary to retract that information given the amount of attention that this has gotten. So this looks like a further attempt from FDLE to just cause more trouble for me for releasing the video of them inside pointing guns at my kids. 13 minutes and 48 seconds is not a justifiable excuse for pointing guns at children. And I'm glad they released it because it shows that everything that I said was true. And it's really just, I don't know. I honestly, God, don't know why in the world they thought that this would help them or that it proves any of the things that they said.
So you're disputing the 20-minute time frame. You're saying it was actually 13, just to clarify.
Yeah, if you watch the video, it's 13 minutes and 48 seconds. I tell them that there are kids in there and there's an officer clearly visible pointing a gun right at my face.
Okay. And then just explain, so the 13 minutes you were getting ready because you thought you were arrested. Just want to make sure, because I think there was.
Yeah, I woke up. My husband said they're here. I heard them banging on the door. I assumed the only reason the police would come was because they were going to arrest me for something, although I didn't know what. And they woke up my 2-year-old daughter, who was downstairs. My husband went down to go get her and bring her up. And I told them just to stay there because I didn't want my children to see me get arrested. And I put on clothes. I'm still wearing my nightshirt, but I grabbed some pants off the floor. I think they were my husband's sweatpants, and went downstairs, hit record on the camera, and opened the door.
Okay.
I stayed there next to them, let them push me around with my hands up the entire time. I was upset that they were pointing guns at my kids, and they treated it as if it was no big deal. And it's not surprising that they would say, oh, this is how we always do it. That's the problem. The problem is that this is how they always do it. The problem is that they point guns at children and don't think anything of it. The problem is that they were going to sledgehammer down my door because they had to wait just over 10 minutes for me to get dressed and come downstairs. That's the problem. Like, I just, the normal practice for police, and this, especially the state police, who's reports directly to the governor, is that this is business as usual. How many people don't have camcorders inside their houses to see what they do? It's very unfortunate that this is the kind of behavior that they think is exemplary of their restraint. So I guess if they had just shot into my house, that would be a lack of restraint, because they're saying that they used restraint by pointing guns at my kids.
Yeah, and you recorded that incident as well, and you posted that, I believe it was on Twitter. Did you post the entire video? Is there more that you're perhaps not showing yet, or that you might in the future?
Yeah, it records for about 23 minutes before the police officers shut it off. It shows, the reason I stopped it there is because my husband comes down the stairs with my kids, my 2-year-old daughter in his arms just as he walked out, and my son right behind him. And I didn't want their faces all over the internet. And I made that very publicly clear, is that my children are not subject to any investigation. My children are not part of any subpoena. They have a right to privacy. My husband is a private citizen and has a right to privacy and is not the object of any investigation. And they released the video without blurring out his face.
And what made you start your own video of this?
I thought if something goes wrong when they arrest me, I want it to be on video.
Okay.
Just so that anything that happened, I would have proof of what happened. And because clearly they will lie, even with video evidence of what they did inside my house, they will lie.
Yeah. And just to play devil's advocate for a second, that law enforcement, I think, as the FDLE commissioner said, when they execute warrants, it is a very dangerous situation, and 10 minutes for law enforcement is different than perhaps 10 minutes for civilians, and that could put themselves in danger. I mean, do you see that other side of this issue, that they could be preparing for the worst, not knowing what was waiting for them on the other side of the door?
No, because I had no registered weapons in my name. They know that. They check that. Myself and my husband do not own weapons. And I clearly came down in my pajamas because they woke us up. And I told them repeatedly that my 2 children were upstairs with my husband. Repeatedly. And then one of the officers pulled out his gun after I said that.
Yeah.
They were there to serve a search warrant for a computer. This was not some like illegal underground drug, cartel type thing. This was a search warrant for a computer for a supposed message that was sent through a system where any person in the public can log in and use it. That's what they were there for, on behest of the governor himself. So no, there was no risk of danger whatsoever, and it does not excuse that behavior at all.
Yeah.
What am I supposed to tell my 11-year-old? I'm sorry they pointed guns at you, Jack, but they're worried that we would come down with an armed militia and shoot them up. But, that's why they have to point guns at you, guns that are bigger than any video game you've probably ever seen. I'm sorry. How is that comforting to my children? How is that comforting to my family? How is that any help to any family? What if my son had, poked his head out because he was scared? What if my 2-year-old daughter had run down the stairs with a loaded weapon pointed up at the stairs? What if she had just jumped out because she's 2? That is the reality of how police operate in this country, and it is sick, and it is not okay.
And can you give us an inventory of the equipment that was taken? Because I read the affidavit, and there was quite an extensive list that I believe also included USB. Words escaping me, but you know what I'm talking about. What was taken from your home?
So they took my phones and 2 laptops, I think, my beautiful HP tower, which is what I did all my work on, and external hard drives. Not sure why you would need that if you're looking for a device that sent an email, but they took all my external hard drives, which had evidence of wrongdoing at the highest levels of government in this state.
In my understanding, are you still able to run your dashboard? Because you started your dashboard after you left the DOH, and I believe you said that you wouldn't be able to do it without that equipment that was taken.
Well, I had no computer, so I couldn't do it for that reason. I missed one day, and I had everything updated the next day. I went out and I got a new one, and I'm back on track.
I'm wondering what you make of all the attention that you're getting, because I saw celebrities are tweeting about you. Your GoFundMe account has raised, I believe, over $200,000. I mean, what has been that? I mean, what has changed in the past couple of days for you?
Honestly, not much, because when things first happened in May, it was crazy like this. A lot of, really intense media attention right away. I'm sure it'll die out and we'll move on to the next thing. And then I spent the next 6 months doing the work, doing the research, building up this organization to track cases throughout the entire country. And I did press. I would go and talk to Chris Cuomo about what was happening in cases with schools across the country. And it is not really that strange to me to be hounded. What is difficult for me is knowing that my personal information and information that can lead to my location was publicized, because now I have to have hired a private security outside my house.
Okay.
That's the difference. I never felt before like my personal safety or the safety of my family was at risk, and now I do.
Yeah. And also, I mentioned the $200,000 that you've raised. What are you going to do with that money? Or do you plan to, I don't know if you started any 501c3s or any corporations, but what is your plan on how to use that money? And also, are you going to tell the public, the people who gave you the money, how do you plan to be transparent how that money is being used?
I updated it today, actually, with where we're at, with where it's going. I made it very clear that I don't want to take anybody's last dollar. I had a couple of people who came to me very early saying, I want to help you, get $10,000 for an attorney. And I didn't want there to be any possibility that somebody could say, I was fundraising secretly and all this other stuff. And since I'm so committed to FDLE, to transparency, I just read FDLE on the screen. Yeah. I wanted to use GoFundMe as the means of which everybody can see what I've gotten and know exactly where it's going. Lawyers' fees, now a private security guard, new equipment, had to get new phone, new laptop, new desktop. I have to have moving expenses pretty soon, because clearly I'm not safe in the state. And anything that I don't need that's not directly related to what happened is going to be donated to a fund for a public legal service that provides legal assistance for whistleblowers. And so everything I don't need for this is going directly to that.
And also, you mentioned the FDA. There's a question that somebody from YouTube is asking.
Yeah, I just saw it. That's why I read it. I was like, wait, what?
Yeah. Do you want to? The question is, they're seeking clarification that the FDLE stopped the recording inside of your home.
Yes, they turned it off.
So they turned off the camera that you had set up to record.
It was sitting on this little, we have one of those 6-foot cat trees for our cat. And it was sitting on a little shelf. It had the little flap open, and I just, hit record. And then one of them closed it and then close the shutter on the camera.
Yeah. Any idea where you might move? I know that you're concerned about the security. And have you given thought to that?
I want to go somewhere where my husband and I can keep working, doing good for the public. And that's all that I care about. If it's near family, that's fantastic. As long as it's out of Florida, it's great.
Okay. And I'm gonna, I think my next question is, thinking of your critics, the people who are skeptical about the things that you said, they might think that you set up a camera in order to frame the FDLE, or that you're trying to seek attention. I mean, what do you say to that? And you're being very open. You're speaking to me in several media outlets. Is that part of your strategy, I guess, to try to get your message out as well?
I wish I had like a formula or an actual strategy. As I said, I've been doing press for the last 6 months. You guys know more than anybody that I never wanted it. The very first story that came out about me was from Florida Today. I begged the reporter to take it down. I begged him. Of course, the damage was already done, and he's a great reporter and he was doing his job. And I highly respect him. But when it first happened, I didn't want any of this. I hid for 5 days. I hid for 5 days thinking people would just move on and it wouldn't affect me. And that didn't happen. And I spoke out of necessity. And since then, I've been trying to just be a voice for any scientists, really anywhere during this virus that can't do that themselves. And that is especially includes people in state government in this state who came to me because they think that what is going on is wrong. And they trusted that I would be able to deliver that information. And I had for 6 months.
Yeah.
And I'm pretty sure if I ignored all interview requests right now, all of the, Rebekah Jones refused to comment would look like I was hiding something. And I'm not. And that's really why it's really, really important to be out there and to say, hey, look, I'm just a person who sits at home and does work on my computer and is trying to inform people. That's it. That's all I do. This takes up some of my time. And the rest of the time, I'm being an advocate for science. And unfortunately, when you're an advocate for science, you make enemies. It shouldn't be that way, but it is.
And the reporter who broke that story is Alessandro Morazzi, who's my colleague. So special shout out to him. But you brought up something that you've mentioned before, that you said that the raid on Monday is bigger than you, that this is about finding people who have been in contact with you, people who still work inside the DOH. You mentioned that there's a purge happening at the Florida Department of Health with a series of resignations and firings. What evidence do you have of that's actually happening? What have you heard, and what can you present?
This was actually something that occurred about the time this message was supposedly sent. The state fired I'm going to get everybody's names mixed up. Alberto Moscaso, who was the previous director of communications for the Department of Health, had been through the entire pandemic. They just up and fired him. He had no idea why. The state then lied and said that he resigned for better opportunities. He says he was fired. And with my experience in the state, I'm going to go with his word 1,000 times to 1. There were also several other significant staff members who were leaders within the state agency who were either forced to resign or who were also fired during this kind of 2-week stretch right after the election. The Sun Sentinel broke a story related to this, in which they named 5 or 6 of those individuals. And they also revealed that in the weeks leading up to the election, Ron DeSantis ordered all of the state health employees not to talk about COVID publicly with anybody, not during any interviews, to just push influenza and other stuff. And so whatever was going on inside DOH during that time period probably led this person to send that message. And it's unfortunate that they fired so many people who, in my own personal experience, were good people, who were, changed from the inside type people. And it looks like they're trying to flush all of those people out. But it's not just DOH employees who come to talk to me. They come to me from other agencies as well. And pretty high up in some of those other agencies. And I'm mostly fearful for those people because they're in positions to actually affect change and do good. And losing those people on the inside would be worse for the general public than anything ever doing with me.
And can you give examples of other agencies?
No.
Okay. I figure what you wanted, but you also filed a whistleblower complaint with the Florida Commission on Human Relations back in July. You accused Governor DeSantis of a pattern of falsifying COVID numbers. I'm stuck on the word falsify because that's a very serious allegation. But what evidence do you have, or can you give examples of that so the public knows what you're talking about?
Because that's ongoing, I'm being muzzled somewhat by legal advice to say don't show your hand. I think is what they're saying. Which now that they have all my stuff, even though they're not technically supposed to look at attorney-client communications about this lawsuit, that's what they're gonna do. So my hand might not be hidden anymore, but there was a lot of evidence, and there still is. I back everything up. So they thought that they had everything, but that's why there's the cloud.
Will you come out with that evidence? Will you make it public at some point?
Yes, we have to wait for the Human Rights Commission to finish its investigation, and then when we file, suit through court, all of that should be disclosed.
Okay.
And it's a lot, and a lot of it has nothing to do with me.
Okay.
There's a lot of evidence in there that other people have given me over the last 6 months that show different types of manipulation and throughout the entire COVID period, even outside of anything that I would have ever known about.
Yeah, and just to clarify, I mean, I know the governor, and we have you here, but I want to make sure that that the public also understands what the governor has said. One of the things he said is that you were putting data on the COVID portal or the dashboard that scientists didn't believe was valid, that shouldn't have been there. And he said, quote, you didn't listen to the people who were your superiors. I believe we kind of spoke about this back when we first, but can you comment on that? This is the governor of Florida saying that you weren't following the advice of people who are experts or in disease control and epidemiologists. What is your response to that?
Well, I was an expert in disease control working with the epidemiologists, and they went to the epidemiologists first and asked them to do to the numbers what they eventually asked me to do. And the epidemiologist told them to get lost. So thinking that I knew nothing about what I was doing, I think they came to me thinking, she'll just change the numbers and, won't cause any fuss. And I didn't. And there were no scientists at DOH who were ever okay with what he was doing. That's why the lead scientist for the response quit in June after 15 years of service on the day that DeSantis announced he'd be forcing schools to reopen brick and mortar. And none of the scientists agreed with that. He wouldn't know because he never even came to talk to us, not once. And he never looked at the data. He looked at the dashboard a couple times and told me, it's great. But that was about it. And his leadership staff were not scientists. They had no idea what they were doing, clearly, because they've gotten nearly 20,000 people in this state killed, which we told them would happen if they did that, and they did not listen. And as far as being insubordinate, I will gladly wear that like a badge of honor, because I did not listen to them, his administration, when they told me to manipulate data, because I would not follow directions that were illegal and that were criminal. And I would hope that any person asked to do something illegal, regardless of who is asking them to do it, would say no.
And who's the person you said resigned after 15?
Scott Pritchard. He was the lead epidemiologist for the entire response period. Quit after 15 years on the day that DeSantis announced that he would be opening schools brick and mortar. I actually spoke to him about it afterwards. And
obviously, from what you're saying, you have a big difference with the governor, concern with what the governor's policies have been during COVID. Seems that you're against shutting or reopening schools. I mean, what could the DOH have done differently? Say if you could go back and say you were rehired, you had power to do whatever you wanted. What should the DOH have done differently in this case?
Well, Scott Rifkes, who's the Surgeon General, who I had encountered multiple times before this, seemed like a good guy. He was pushed out by DeSantis and his staff very early on. Quite famously, he was pulled out of a press conference for saying that people should expect to wear masks and, alter their behavior for at least through the year, which we now know it's going to continue much longer before that. seemed uncontroversial, was completely within accepted science everywhere in the world. And he was pulled out, and we didn't see him again after that around the office. So they got rid of any scientist who gave them a problem. And I don't think that any scientist would agree with anything that Florida's doing. There's no state mask mandate. There's no mask mandate in 30 of the 67 counties in the state for schools. And that's why our student case rate is so high and our staff case rate is so high, because staff are more likely to have a higher rate of infection compared to children when there's no mask mandate in place. And I would have just listened to the science. I really would have. I followed the science. If the science says it's totally safe to open up schools, then it's safe. If it says it's not, then it's not. And if your policy costs one unnecessary death, one preventable death, then it's a failure. I asked them about the time all this was going on. I sat down and I actually said this directly to the chief of staff. I said, are more people going to suffer and die if we do this than if we didn't? And if that answer is yes, then we shouldn't do it. It's that simple to me. It's always been that black and white to me. I got into disaster response and studying hurricanes and climate change because I wanted to help people. I wanted to stop suffering to whatever extent was in my capability to do. And I would not be a part of something that they knew would cause this many deaths and did it anyways.
But also, besides just what decisions you make with the data you're given, it seems like what you've claimed all along is that the data itself wasn't being presented. And again, I'm not a geographer like you are, but wasn't being presented in a way that was accurate. But how much manipulation of the data are you saying that that's happening? Is it tweaking a number here and there, or is it something that completely changes the picture of what's actually happening?
It's both. If you tweak a thing here and there in so many different places, it ends up with something that looks nothing like what you started with. They've now interfered with how they report deaths. And when I say they, I mean DeSantis' administration. 4 separate times. 4 times interfered with how deaths are reported in the state. We average between 90 and 100 a day, but it's capped at that because that's now their capacity based on the staffing. They have to do that. They changed the policy so that COVID-19 has to be the #1 cause of death. If you died from the pneumonia that COVID-19 caused, you may not ever count. It has to be signed and received by a medical examiner, which takes time. So those deaths there's a huge lag that Florida's now notorious for and how long deaths are reported. So we're finding out about deaths months after they happen. However many people died today, we probably won't find out about it for weeks, if not longer. And there's been too much interruption. And it's not just deaths, it's hospitalizations as well. The administration stepped in and said that they would not count anybody who didn't have a primary diagnosis again of COVID-19. So again, you come in with cardiac arrest that was caused by COVID-19, you're a cardiac arrest patient. You're not a COVID-19 patient. And this results in between several thousand on any given day to now during the peak, up to 1,000 people who are in the hospital with COVID who are not being reported as COVID cases. And this is seriously problematic. And it's hard for those 2 metrics to not matter. We want to understand how this virus works by understanding how many people are becoming critically ill and how many people are dying. And when researchers and the public do not have that data, they're not making informed decisions the way that they should be, the way that they're entitled to, really. And that's not something that is okay by any means.
Yeah. And when you're saying that the way that deaths and hospitalizations are being reported, you saying that you actually saw that happening? Say one death is moved from one column to the other, for example, assuming I'm probably simplifying how that's actually done, but you're saying that you actually saw that happening?
Oh, yeah. And there were deaths that were removed because COVID-19 was the 3rd diagnosis because they had cardiac arrest that was caused by the pneumonia that was caused by the COVID-19. There was a 2-year-old boy in Escambia County who was positive on one day and in the hospital the next week and then dead the week after that and died from COVID-19. And they actually went back and deleted him. He died. He's dead. But in the DOH data set, he's alive. And that kind of manipulation of data means that when you calculate pediatric death rates for example, that there are people who are not in there that have died. And that makes it very difficult to come up with really good, solid statistics. And it makes it open to speculation. Oh, well, if they're only providing this, all we can say is this is the minimum. This is at least how bad it is. That's how that data should be taken. This is at least this bad. This is what they're willing to admit to. And what they're admitting to is really, really bad.
And what do you think is the real death number in Florida?
The CDC estimates that Florida has underreported between 6,000 and 8,000 deaths. We are one of a handful of states that does not track or report probable deaths. So people who died without ever receiving a COVID-19 PCR or antigen test, but a doctor examined them and said, you know, this is a person who had this virus. We took x-rays of their lungs, or the medical examiner says that. If they didn't have a positive lab, they're never going to count. Not in Florida. Florida is second in underreporting deaths, according to the CDC. And we're, I think, fourth in deaths right now, based on the CDC estimates. So it's only going to get worse. And I really want to take this second to just say, if you're considering traveling for Christmas or seeing people for Christmas and you're making those plans now, don't. Please don't. We really just need to get through the next few months, let this vaccine roll out, do its job, and then we can start to slowly get back to normal. It's really hard to give up things that feel bigger than just, you know, a superficial trip to the bar or whatever for a few months. And Christmas matters to a lot of people. The whole holiday season does. But if we don't skip this one, it's going to be a lot of people's last Christmas when it does not have to be. So please reconsider. And this is not guidance that I, mysteriously came up with. This is every epidemiologist in this country, the CDC, everyone who warned everybody not to travel for Thanksgiving, but they did it anyways. And it's really important that people realize that this might be hard. But if we don't do this, there's a lot of people that won't be here for Christmas next year that could be if we just didn't.
So on that note, Rebekah, I know we only had 30 minutes and we're at 33. So I want to thank you for talking
almost
to us.
all over.
And I'm gonna expect more information to come out once the investigation by, I believe it's called the Commission of Ethics, is done. So I'm gonna
should be
do my best to hold you accountable. Yeah. I'm sorry, what?
It should be any day now, but it's the state investigating the state agency. So well, so this isn't going to be over anytime soon, and that's unfortunate, but they have power, and I'm just a girl with a laptop.
Yes. Well, thank you. This was Rebekah Jones, and go to floridatoday.com or one of our USA Today Network sites to read more about her case and her story. Thank you again, Rebekah.
Thank you, guys.